having the baby skin to their mother, the minute the baby is out, it's important for both of them. Babies start smelling the microbiome of the mother, so it's starting to make his own immunological health. When you're pregnant, please don't fast. You have to come out from cetogenic diets and do carbs and fruits and vegetables, obviously many colors, because these ketones can damage the brain of a baby.
How to take care of yourself in pregnancy, because that's going to influence outcomes when it comes to mom's health, baby's health, and the delivery.
Dr. Cynthia Dickter
is the OB-GYN transforming women's health with a powerful blend of science, soul, and compassion.
She's one of Mexico's most sought-after doctors, known for championing humanized birth, mastering hormone balance,
and approaching medicine with deep respect for the mind-body connection.
With a massive following and a reputation for making women feel truly seen, heard, and empowered.
Dr. Dickter is the kind of doctor you wish you had.
Having good amount of vitamin D, that we know it's like a pre-hormone, and in pregnancy it's so important. You have less risk of gestational diabetes. We know that if you develop gestational diabetes, you have 50% chance to get.
What makes a high-risk pregnancy? What are some of those factors?
Oof, here it's tricky, and I'm gonna tell you why. I mean, the first thing is...
Welcome back to the Dr. Brighten Show. I'm your host, Dr. Jolene Brighten. I'm board certified in naturopathic endocrinology, a nutrition scientist, a certified sex counselor, and a certified menopause specialist. As always, I'm bringing you the latest, most up-to-date information to help you take charge of your health and take back your hormones. If you enjoy this kind of information, I invite you to visit my website, drbrighten.com, where I have a ton of free resources for you, including a newsletter that brings you some of the best information, including updates on this podcast. Now, as always, this information is brought to you cost-free, and because of that, I have to say thank you to my sponsors for making this possible. It's my aim to make sure that you can have all the tools and resources in your hands and that we end the gatekeeping. And in order to do that, I do have to get support for this podcast. Thank you so much for being here. I know your time is so valuable and so important, and it's not lost on me that you're sharing it with me right now. Don't forget to subscribe, leave a comment, or share this with a friend, because it helps this podcast get out to everyone who needs it. All right, let's dive in. Dr. Cynthia Dickter, welcome to the show. I'm so excited for today's episode.
Thank you so much. I'm so excited to be here.
Yes, we're going to be getting, this is really like the pregnancy episode, the birth episode. We're going to be getting into a lot of things that people have been asking who watch the show, and I think you're the perfect person to be talking to us about the topic of a humanized birth. So there's a whole movement around this. Can you share what that is?
Definitely. It's my passion, so I'm happy to be here, and I'm glad that I can talk about that. I did my residency in a hospital that is like pretty technical, like pretty typical. I didn't know about these humanized labors or anything about that, but just at that time, my sister was having her children, and she was studying about that, and she was finding out about this skin to skin. What's that about?
Yeah.
Why the baby with a mother? What about the late clamping of the cord and everything? So I started to look around, and I saw having her 3 wonderful daughters in a humanized possibilities with humanized births, and it was awesome for me. So when I finished my studies, my residency, my OB-GYN residency, is that how you say it in English, residency?
We say OB-GYN, but some people say OB-GYN. People know what you're talking about, but yeah.
Perfect. When I finished studying OB-GYN, then I looked for a doctor that does humanized labor, and I went to work with him to learn everything about it. Mm-hmm. And then I started practicing all about humanized labor, and I went to the U.S. with another doctor to see what they were doing there, because they don't do it everywhere. They just do it in some places. And I learned everything about it. Like, I know it's not something that it's new. It's something that it started like in 86 or something like that.
Or maybe when we started having babies, like when our species began.
Actually, yeah. it's taking us back to what it has to be, right?
But we had to have this remembering, this movement in the 80s to come back to this, which like, I actually want to, since you brought that up, ask that question. So like, what was going on pre-80s that made it to where we had to shift things, we had to change things? Because births were very different then.
There were so many C-sections. And I want to really be clear here that nobody did them to harm anyone. You know, they thought it was the best.
Yeah.
They thought doing an episiotomy is the best. They thought taking the baby from her mother and taking it to the NICU was the best. They was doing what they knew best, you know? So the birth started to medicalize so much, and the human part of it just went out. And we became so much doctors, and we were treating a healthy woman as a sick woman.
Yeah.
We weren't treating a pregnancy like a part of life. They were treating pregnancy like a scary thing.
Yeah.
So that's what in my mind happened. So they had to do this movement, and many countries just reunited in Brazil, and they said, we have to stop this. Something has to change. And all this obstetric violence started, and that's why they started this humanized births, and the way they had to change. They started seeing how many vaginal births and how many C-sections there were in every country, in every hospital, and too many things that we're gonna talk about. So that's how it started. I feel really grateful and humble that I can be part of this movement, and that I can have this flag about it, because I definitely think it's what I did with me. I have 2 vaginal births that I fought really hard about, and I'm happy to share my story, and that's what I believe in.
Yeah.
So,
well, I love the humanized birth movement because it puts so much power in the patient and so much trust in their own body. Whereas I feel like when things got over-medicalized and pathologized, right? You're pregnant, it's like you have a disease. Women really lost their power. They became afraid of birth. And I think that is also what started to breed the mistrust between patients and doctors, and women being fearful because we see things swing the opposite way, where women are like, I'm not even going to have a doctor during pregnancy. I'm not going to go to a hospital. I'm going to do an unassisted birth, which, you know, there's going to be people out there, even as I say that, say, it worked for me, it was great for me, but there are people who have died, infants who have died. We don't want that. But I think that's something we also have to recognize, is that when we start to see this distrust in your own body, really women start to be like, wait, maybe it's you I shouldn't trust. And that's where things can become more dangerous. I do want to say we're going to talk about C-sections today. Yeah. We're going to be critical about some of the aspects about it, but anyone who's listening, if they've had a C-section, we're not judging you. The end of the story, we want to be a happy ending of however you got to healthy mama, healthy baby. That is fantastic. So I don't want anyone to feel judged. I know I brought you on because I know that you're not going to. No. And so, but I just want to start there in case anybody's listening to this and they're like, maybe I just want to turn this off because I don't know if I want to hear anything bad.
No.
So
actually, I can say about myself that I'm gray. You know, I'm not extreme in anything in my life. I think that extremes are not good in anything. So actually, I do work in a hospital. I think it's one of the best hospitals in Mexico City. For me, it is important to work in a hospital. And we have changed so much.
No,
it has changed
heard
so
that you've
much.
been the leader in changing a lot of that.
Me and more people, not just me.
Well, I'm sure it's not just you, but
the director it's a woman director. She's done so much. My partner, that it's 10 years older than me, has done so much. But when I started my residency there, or where we have now, like looking at time, it's so different. And I want to tell you, like, it was a hospital when we didn't have LDR rooms, and we're gonna talk about what it is and what's the importance of it. And in the same hospital, we have the doctors that doesn't like that and won't ever work in an LDR room, and that's totally respectful. And I do want to say here that I know this is public. This is public, and many people are listening. We're not judging anybody, and we're not judging any kind of medicine or any kind of a practice they do, but this is what I do, this is what I love, this is in what I believe, and it's changed so much. And it's just me, the pediatricians. Now there are LDR rooms. Baby goes skin to skin to the mama. We do like clamping of the cordon. We start the breastfeeding immediately. There's a breastfeeding consultant in the hospital. That's everything. It's pretty new for us.
Yeah.
So it's amazing to see how long we have accomplished.
Mm-hmm. You know, something that...
How much?
Yeah, no, I'm sure we're all picking up what you're putting down. The thing I thought is interesting, I actually had to have 2 imaging procedures here. I met with 2 different doctors, and each time when they asked me about my obstetric history, and when they were like, how were your babies delivered? And I said, vaginal. They were like, oh, good for you. And I just thought that was like such an interesting comment to say, like, good for you. And I'm just like, well, this is how babies come out, like, and that's the way it all worked out. But that attitude, it makes me just wonder, you know, is that kind of part of the undercurrent of why there's had to be this movement and why things, you know, have really needed to change, because it's this idea of like, wow, vaginal, that's like a miracle that this could happen.
I think there are many things why this happened. One of the things here in Mexico City, it's private practice, or is like social.
It's the public hospitals.
Public hospitals. So I do the private practice, and I think I am I have the privilege.
Yeah.
I have the privilege of doing private practice and can be managed by a private doctor, but we're talking about this
small subset of the population.
This small population. What the most that I would love is talk to you about that this is Mexico City, and it's not. The humanized part, we are doing it in a private practice in a small group. Yeah. Okay. So what we're doing, it's because they can, and in a private practice, what I want to say, it's really hard for a doctor, because in Mexico there are no shifts, right? Like let's say you're my patient and you have your birth 3 a.m. any days, then I have to be there, because people don't believe in shifts or don't believe in groups. That's something really bad about Mexico City that we have to change, that I want to change. So people just married with a doctor and they want that doctor to be there. So I can have a little bit of compassion of these doctors that have been there for 30 years and they are tired, you know what I mean? And they cannot do the best they can. So they are starting to do this, like, let's induce, or let's do a C-section, or that, because it's easy, because it's for them in their mind. There's no complication. They can do a schedule, So there are many things that have to change, starting for the whole system.
Yeah. And, everything you're talking about as you speak about Mexico, they're the same exact issues that the United States faces as well. So for anyone listening, anyone who's had a baby already knows about all of these issues they face. We're going to get into C-sections. We're going to talk more about all of that. But you've mentioned skin to skin.
Yeah.
Why is skin to skin important? What's the timing of that matters? What should women know?
Skin to skin is, I think, one of my favorite parts of birth, and I'm not talking about a vaginal or a C-section delivery. I think skin to skin, if there's a possibility, it's so important. We have scientific reviews and research that having the baby skin to their mother, the minute the baby is out, it's important for both of them. And I'm gonna explain.
Yeah, I want to hear it.
Yeah, okay. The baby adapts better.
Yeah.
Okay, the temperature with the skin of the mother gets perfectly, like, it doesn't get cold or hot. It regulates its temperature with the skin of the mother. It regulates its heartbeat, because it's hearing the heartbeat of the mother that he knows. He knows it from the 9 months being inside of her. Okay, he's listening and of what he's used to listen. Babies start licking and smelling the microbiome of the mother, that every family has a different one. So it's starting to make his own
Yeah, the immunological health.
Yeah, immunological health and
that is
system.
Such a tricky one in English.
So
I know.
I'm sorry. Immunological health.
Yeah.
So babies, it's impressive because I've seen so many births and they don't cry because they are calm. They are with their mothers. They are with good temperature. They're breastfeeding the first hour. So that's definitely a good way to get to an excellent breastfed lactation. In Spanish we say lactancia exitosa. How do you say
establishing lactation?
Yeah, establishing lactation. And for the mother, so many things. Having your baby with you when baby is born, your hormones are perfectly balanced. Yeah, so the prolactin goes up, so you start breastfeeding. And when the placenta goes out, estrogen and progesterone, they go down. You have like a little
That's
menopause.
Your glimpse into menopause. That's exactly going to say.
Small menopause.
Yeah.
So having your baby, it leads to less postpartum depression. You bleed less because you have your baby, so you start producing more oxytocin, and this oxytocin naturally will just contract the uterus, so they will bleed less. They will have less depression. They will feel safer, and that's the way it has to be. I mean, think about how the baby comes out to this new world in a cold OR or wherever, and with these people they don't know, and taking the baby with a leg like that, that's not natural. And think about how these women of the caverns did it. The ones that did the birth were their husbands, and then it was something from women to women. There were the midwives that we don't have here in Mexico City. And it was a woman job doing by women, somebody that knew what happened, that knew how it felt.
Yeah.
And that believed that in the power, in your woman power. Like you said, you go to a doctor, you trust the doctor, and you give the doctor all your power.
Yeah.
And you believe everything they say. Even though me being like a doctor, when I'm pregnant, I get really scared because I have high risk pregnancy. I put like all my faith in what they say. So I believe that they say I can, I can. If they say I can't, then I'm gonna believe it. So our word, it's so meaningful for women.
Yeah, that's so powerful. Can you talk more about the mindset and your physician believing in your ability to birth? To have this, I'm careful to say natural birth. I feel like that kind of triggers people because, they feel like, I think that a lot of times when we talk about birth, when we talk about pregnancy, really when we talk about a lot of things about being a woman, it's always like there's this hierarchy and there's the who gets the badge of honor and who wins the trophy and who, and it is something that we all come up to birth and we have to do it in our own way. There's this own purpose, our own purpose, and there's a learning and experience in our own body. But I just wonder, in terms of the physician's mindset, the physician's belief, how does that impact the patient?
Actually, before I was coming here, I didn't know how to say humanized birth. I thought that wasn't a thing you can say in English. So I just went to ChatGPT and it said patient-centered.
Yes, we say patient-centered. Yeah.
Practice, right? So that's what it is. You have to center in the patient. What does the patient want? What does the patient need? How can you give the tools and the information to get there? Do you know what I mean? If you believe she can, for me, I tell them, I definitely believe in vaginal births. If I didn't, I wouldn't go through that with my body, right? So there are many things, but I think giving the right information, doing a right prenatal care, so you can be really so you can be safe and you can be calm when the baby comes, and just trusting, and what I want to say here is that respected births or a patient-centered or humanized or whatever you want to say, it doesn't just talk about vaginal. It talk about listening to what the patient needs. I do C-sections. Of course I do them. And thanks God they exist.
Yes.
Because some women, they just need a C-section. The obstetrician has emergencies and has previous myomectomies or placentas previas or breech babies, whatever, many things.
Yeah.
And we have to do C-sections. But how do you do it? The way you do it, it's going to change everything. Like, for that woman, having her baby is once in a lifetime. It's that family experience. So how you deliver that and have the baby comes to the world, I think it's really important.
Absolutely. You know, you had mentioned the partner before, how like it used to be like your partner attended the birth. I'm just wondering, for people who are listening, maybe partners are listening.
Yeah.
How can they be a helpful part of the pregnancy, of the birth process? Because I think sometimes partners don't know what their role is, where they fit, how they can help.
They don't have an idea how important they are supporting what we go through. I mean, you've been through it. Hormones go crazy when we're pregnant. So having this support and this like knowledge and I want to say entendimiento, like the knowledge of what you're going through, it's so important because you have somebody to lay on, right?
Yeah.
And they can do so much. Going with you to the doctor, massaging your food, giving you the right nutrition, helping you with your toddler, talking to you about what you're feeling, being with you about how you want your child to come to the world. It's not just the woman child, it's his child too.
Yeah.
Right? So how do you want your children to come? How do you want your children to grow too, right? So you know that the first voice that they recognize is the father's voice.
Oh, I didn't know that.
You didn't know that? Because your voice, like the mother's voice, it doesn't, they cannot hear it well because it does an echo with the amniotic fluid. So when babies come out and the father starts talking to them, they just get calm. Because they recognize that.
Yeah.
Right? So yeah, I mean, partners or fathers, wherever they are, they're so important.
So do you encourage talking to the belly?
I do,
Yeah.
of course. Of course, I encourage talking to the belly, definitely, yeah.
Yeah.
And being there when babies are born. In my births, my patient births, the father cuts the cord, so they are part of the experience. They feel part of it, and they can be encouraging women if they have a birth plan. Basically, you do a birth plan, right, with your partner, so he knows what you want.
Yeah.
Right. So when you're there and there's a brief time that it's called before you get to 10 centimeters that you just go crazy. You think you cannot do it anymore, and I don't remember the word. It's trans in Spanish.
The transition?
Yeah, it's
the transitional phase. Yes,
the transitional phase.
And it's always like right before the baby's going to come that you're like, I can't do this.
I can't do it.
I'm going to give up. And
Give
then the
me the
baby's
epidural,
like,
right.
I am here.
Yeah, give me the epidural. So that's when the partner has to come and say, you can do it. You're doing it. You're there.
Yeah.
Come on. It's like respecting your wishes. So there are so many ways that they can be supporting.
Yeah. Well, and I think that's important for them to hear, because I think, sometimes it can feel, especially when it's the first birth, like, what am I supposed to be doing?
Yeah.
And I love the idea of the birth plan ahead of time with the partner, because once it's like you make all your plans, right? And birth is like the most humbling. Like it does not go the way you plan a lot of the times. And so to have that conversation ahead of time really opens up and bridges a gap maybe in the communication, so that when you are in that moment, you can communicate the things that you need as well. You mentioned nutrition. You were like, feed her well. What do you recommend in terms of, so what I want to talk about is how to take care of yourself in pregnancy, because that's going to influence outcomes when it comes to mom's health, baby's health, and the delivery. I think sometimes people get so focused on what can I control in the delivery room, not realizing there's a lot that you might not be able to do, but there's so much that in that 9 months and even in the preconception phase that you can be doing to ensure you have the healthiest pregnancy.
Okay, I'm gonna quote you because you talk.
You can quote me.
Yeah,
okay.
I can quote you because you talk about this a lot. But preparing your body for pregnancy is really important. These 3 months before the
ovulate. Yeah.
Before you ovulate, you have 3 months.
Let me just say, I like your Spanish words so much, though. Every time I'm like, just ovulations never sounded so pretty.
Great. So when you recruit this ovulum, you have 3 months. Mm-hmm. So it's really important with what you're feeding your body, right?
Yeah.
For you and for the sperms too, no? What you're eating and what you're thinking, how is your stress being managed? How are you sleeping for a good ovulation? And then after that, having a healthy pregnancy, not getting so much weight, doing exercise, sleeping good, meditating, everything it's gonna turn in how are you gonna get to the delivery.
Yeah.
Right? So supplementing yourself with supplements, it's really important. Like here in Mexico, there's no folate. There's ácido fólico. And we know...
Let's talk about that.
Yeah.
Folic acid versus folate. Because my prenatal that I make is methylfolate.
Please.
And our B vitamins even have folinic acid and different forms to try to make sure that everybody can utilize these. But you'll see a lot of people who say folic acid only.
Because I think they don't know. There are more than 40% of women, they just won't metabolize the folic acid.
Yeah.
So you want to give the easiest form so they can absorb it.
Yeah.
And we know it's really important for the sperms, for the ovulum, and we know it's really important for the baby to develop and for the spine, no? So
yeah.
And for many things. So having a nice vitamins B that are in a, how do you say, methylated? Methylated, so they can be absorbed. And eating a lot of eggs, having choline, for the brain, for the eyes of the baby. Having good amount of vitamin D that we know it's like a pre-hormone, and in pregnancy it's so important. We have been seeing in researches that if you have a good amount of vitamin D, then you have less risk of gestational diabetes.
Yeah,
we know
huge.
that if you develop gestational diabetes, your baby, you can impact on the genes of your baby. So it's not just you, it's what you want for your baby when it's an adult, when he grows up. If you develop gestational diabetes, you have 50% chance to get diabetes in the rest of your life.
Yeah.
So basically what you eat in pregnancy, it is important.
And as you were talking about with the weight gain as well, that is such a big component because that can increase the risk of gestational diabetes. Depending on where you gain weight, that can increase inflammation in the body. And so, sometimes I think, I've seen people who are part of the body positivity movement who are they're being too aggressive about weight when it's in pregnancy, but to recognize that it's because it impacts the genes of the developing organism, which is the future of our species. We need to be keeping not just baby healthy, but mom healthy. So what are the risks when it comes to delivery and gestational diabetes?
The risk is that you do a pretty big baby, above 4 kilos baby, then definitely a vaginal delivery is going to be harder. And if we know what are the qualities or the good things about having a vaginal birth, then if you want to try that, then it will be difficult for you. The baby, when it comes out, it could break the
collarbone.
The collarbone. For me, the most important thing is that you can impact on his genes forever.
Yeah.
I mean, okay, you have a C-section, fine, that you can manage that. But you knowing that you're gonna give the baby that risk, it's pretty cultural, because many years ago they still, I mean, here, like the grandmas, they say like you have to eat for two, right?
Yeah.
You have to eat 2 plates of food, and that's not true. Actually, you just need 400 more calories in the second part or the second trimester.
Yeah.
The first part, you just have to eat regularly.
If you can eat.
Yeah, exactly. If you can eat.
Yeah.
So there's no need to gain so much weight. And I do understand this movement about not being so harsh on the weight and everything, but not in an extreme way too, because then you gain like I don't know in pounds, but 20 kilos.
Yeah.
And it's not good for you, and it's not good for baby.
Yeah.
Babies, when they get born, they have hypoglycemias. If you have a gestational diabetes, because all pregnancy, their glucose levels are so high.
Yeah.
So are there many things that you want to avoid?
So what tips do you have for people who are super nauseous in the first trimester?
The best tip is ginger.
Oh, okay.
Yeah, and it's based, like scientific based research. The ginger is great. So you take the whole ginger and you put it in warm water and you do a concentrate, right?
Yeah.
And then you just dilute it with water and put it in the freezer. So you have this cold ginger tea.
Yeah.
It is really good. Definitely we have some medications that we can give, but I think just like natural ways, I love ginger. Eating like every 2-3 hours, not having your stomach empty. Eating dry things, no, like dry cookies.
This is where rice cakes,
rice,
like your best friend.
Rice cakes, exactly. Not eating warm things like a soup. It will just like distend the stomach. So eating like cold things like ice pops or a gelatin or something like that. Yeah.
No, I definitely was like, it wasn't until I was pregnant I realized how bad water could taste and how bad like romaine lettuce could smell. And I'm like, these things don't even like, water doesn't even really have a taste, and romaine lettuce, like, it doesn't have a smell. But when you're pregnant, you're like, everything. It's everything. But ice water was just the thing that I had to sip on all the time.
And you know what? I'm not that strict the first trimester, because I know it's really hard. So I say, if you feel like having Doritos nachos, do it.
Yeah.
You know, like go for your chips. It's okay. You'll enter your second trimester and you will make better decisions.
Yeah.
And you were 3 months before that, you were doing good. And the baby, the first trimester, it's gonna really use your hormones more than what you're eating. And then after week 10, when your placenta is there, then it's gonna matter more.
Yeah.
So having after the first trimester, having good quality of proteins, good quality of like oils.
What kind of
fats.
oils? Yeah. What kind of fats would you recommend?
Avocado. The egg, the whole egg.
Yeah,
the yolks are great because of the choline. So like the best breakfast is 2 or 3 whole eggs. It's great. The aceite de oliva. Olive oil, sorry.
Olive oil, yeah.
Avocado,
It took me a minute,
olive
but I'm
oil,
like, yes.
Nuts and seeds. The salmon has great, protein and has great fats. So all of that I love. What
So
else?
you were talking about proteins, fats. What else do you recommend?
Good carbs.
Like, what are good carbs?
Carbs that don't spike your glucose, right? Like more
like whole grains?
Whole grains,
yeah.
Exactly. And oats. You can do. I love masa madre bread. That it's, how do you say it? Sour bread?
Sourdough bread.
Sourdough bread. It's really, really good.
And it can actually, as toast, can be like a savior for nausea in the first trimester too.
Definitely. Yeah, having nice quality of fish too, and not like wild fish because of the mercury that can have. Just 2 or 3 times a week, it's really good. What else I can say? Oh, tons of water. Being really hydrated, it's really important. Not fasting. You know that right now there's like this huge thing about fasting, and I know it's really good for many people and hormones and whatever. But when you're pregnant, please don't fast. It's really important that you have your glucose levels consistent and balanced. And actually, when you are in cetosis, like
ketosis,
when you're fasting, then these ketones can damage the brain of a baby. So
interesting.
Yeah, it is interesting.
That is good to know, because there are women who will not only fast, but also there's those who do a ketogenic diet, trying to keep their ketones
I will
up.
never suggest that. When you're pregnant, you have to come out from cetogenic diets and do carbs and fruits and vegetables. Obviously, many colors. Like having a lot of Brussels sprouts and broccoli and all of these that you can like digest the hormones. So.
Yeah. So I'm glad that you brought that up. I wasn't aware that the ketones could cause harm to baby's brain. And I think that a lot of women listening, I mean, that's not their goal. If they're pregnant, it's to have a healthy baby. So I think that's a really important tip to share.
Yeah.
For women who are wanting, so they're going to have a hospital birth. Some of us have to because of being high risk. And you know what? Maybe we should define that, because you've been high risk, I've been high risk, but maybe some people don't know what that is. So what makes a high risk pregnancy? What are some of those factors?
Oof, here it's tricky. I'm gonna tell you why. I mean, the first thing is I was high risk because I do have thrombophilias. I lost 2 babies. I was anticoagulated, and my baby, the first one, was restricted. So I had an induction.
Okay.
But you cannot say in obstetrics that there's like a high risk and a non-risk pregnancy.
Yeah.
That's why you can have this perfect pregnancy, this perfect like delivery, whatever. Well, how do you say trabajo de parto when you're doing the delivery? How do you
when
say
you're
that?
laboring?
Yeah, when you're laboring, and then the placenta can detach or something can happen, and it could be like an emergency in that minute. So if you decide to have a home birth, if you have like all the low risks, and I'm quoting with my fingers, like a low risk pregnancy to do that, just be aware that you are in good hands and that you have a hospital near you. I think right now what I love about my practice is that I'm between everything. I'm not doing, like I told you, I'm gray. I'm not doing home births because I don't think in Mexico City we're safe enough. The traffic, I mean, they do it in Europe, and I think it's okay because they do that all the time. So they know how to do it, and they have the ambulance at the house there, and they have a plan if they have to go to the hospital. We don't have here in Mexico City. But I don't think that if everything is going perfect with your laboring, I don't think you have to have a C-section or an induction or even an IV if you don't need it.
Yeah.
I think you can have your baby in the position that you like. I love babies being born in a silla maya. I don't know if you know a silla maya.
No, what is that?
But if you have another baby, you can try it. It's awesome. A silla maya, it's like a.
Is it a seat? Is it the U-shaped seat?
Yeah,
I tried that with my first. My first was, I had this dream for a water birth, and I ended up on all fours, and that was the only way he was going to come out. And then my second one, I was like, oh, I'm going to like labor in the tub, and then we'll just see what happens. And then it was in the tub that I was like, this is where it has to happen. This is the way it's going to be. Anyway. And it's so funny. This is why I say, like, you make your plans, you have your ideas, and then your body, if you listen, it will guide you, it will tell you. But yes, they tried the seats. They tried a lot of things with me. And I
love silla maya in the shower, for example.
Not a lot of people like to deliver to a woman on all fours. It's a very awkward position. But I was like, my husband knew that I was like, I came out and I was like, this is how the baby's coming out. This is the way it is. And they're like, it's not the best position. I was like, I'm telling you, this is where my strength is. This is where my power is. And then he was out in 10 minutes. And I was like, after 24 hours of labor, and I'm like, oh, but the seat, like, I thought, oh, this will be the thing. Yeah, but tell us more about it. I interrupted with like a little detour.
No, I love hearing you. I love that you had this strength on you and that you believed in your body.
It didn't for a long time. That's why I think I got 24 hours of labor. And it wasn't until it was like, remember who you are, and like, just remember. And I was like, I don't care what you have to say, like, this is the way I will birth. And then I'm kind of a pain when it comes to labor, because I'm like, don't look at me, don't touch at me, don't turn on lights, don't breathe near me. Like, if you're looking at me, I'm like, don't look at me, I'm laboring, like, leave. I feel like, you know how
you're being a mammal. That's what it is.
I was just gonna say, you know how like cats, dogs, they'll like go somewhere really private. That's me. I just wish no one could be there. But then there's monitoring that has to happen, and then you know.
But it's okay. Monitoring, it's okay. You can make that. You can do both. Yeah. Right. So yeah. What did you ask me about this? About the seats. What were we talking about? Yeah, the CMA. My experience is that in the first babies it's harder, but when it comes to a second baby or a third baby, a second or third birth, it's really, really nice. I like to do it in the shower, so they have all the water running through their body, and then they sit there and baby comes out really nicely. They take the baby, and I love it. Yeah, it's really nice. It's something that we like to experience. We have this bed that you can changes the position, so you can try the position that you like, and it really depends on the epidural too. Yeah, because in Mexico we don't have so many different things to try for the pain. Like there you have this gas and you have this IV medications. Yeah. Here we don't. Here we just do the epidural or no. And my anesthesiologist, that it's a crack, he's doing walking epidurals from now. Yeah. He's been doing it we've been trying I think 3 or 4 hours, and it's a lovely thing to do for the women that do want to have an epidural. So being respectful, it's hearing what they want too. I had my first baby, she was an induction. She was restricted 37 weeks. So I was there. We started 10 p.m. She was born the day after 3 p.m. So 12 hours later, I begged for an epidural. Yeah. And I was fine with it, and it was an awesome birth. My second baby, she wasn't restricted. At 38 weeks, she came, and I didn't do the epidural. I really prepared myself not to have it, and I didn't, but she stopped. So it was really, really painful. Yeah. And actually I'm still recovering from what happened. But for me, at the end, it was something that I really, really wanted it to happen. So there are many, many things that they can experience. I think hearing what they need and what they want, you can do a shot and then don't do it, and then breathe the pain for a little bit and then don't. Yeah. Working with a doula, it's really good. Here we don't have midwives, but doulas can accompany you really nicely. Yeah. They are women that have had babies before, and they do this physical therapy and encourage women to have their babies. Yeah. I didn't have a doula with my first. I had a doula with my second. And it was really beautiful because the doctors just stood to the side and let her just really be there with me. And it was only when it was absolutely necessary for them to come in, then they would be like, okay, we're going to check fetal heart rate. It was just a very great dynamic the team had. And I was really grateful to have her. I want to go back. But with the high risk, so your point was, all pregnancy has risk. Yeah. There is no neutral state. It all has risk. There's risk with labor. Correct. But what are the how do doctors categorize high risk? So, for example, my second, I was 40, so that's high risk. I have Hashimoto's hypothyroidism. That was considered high risk in terms of the monitoring, because I needed to make sure that, there weren't antibodies that potentially crossed the placenta. We had to screen for baby's thyroid and make sure everything was okay there. But in terms of what women should know going into labor, that would make them a candidate for being categorized as high risk, that they just need to be aware of. High risk, yeah. Age. It's high risk. Yeah. It is. It's not fun. But just actually, in the U.S., above 35 it's considered a, how do you say it? They say geriatric. Yeah, pregnancy. Geriatric. I had my daughter when I was 35, and I don't feel geriatric, but whatever. I know. Well, I'm early 40s. I don't feel geriatric, but what is it? When is it considered you've got an old uterus in Mexico? I really hate that, but that's medicine's classification. It's changing because lately women are having children older and older because we're being doctors and lawyers and we're studying and we're doing things. So this is changing every day. But 38, 39. Having gestational diabetes.
Okay.
Having hypertension. Having,
which is high blood pressure.
High blood pressure. Having a previous C-section.
Okay.
Having twins. Having placenta previa, of course.
And what is that?
It's when the placenta, it's attached above the cervix.
Okay.
Okay, the cervix, it's the...
the opening of the uterus,
Yeah.
there's the little os, and then the placenta sitting right here.
So you cannot have the placenta coming before the baby because you won't oxygenate the baby. So this is a true. I don't want to say thing. This is a true
high risk.
No, this is a reason, a true reason to make a C-section.
Okay,
you cannot have a vaginal birth, obviously, right?
Yeah.
So I think those are the most common. Yeah.
I think it's important for women to know as well, because when they get on the internet and they start to Google things, they can find like all kinds of things out there, and it might be, different. Given different conditions someone might have, because we say like these are the one things, but you could have several things that then are like, now this is something where we need to monitor you, that you should, it should be a situation where you are having a hospital birth rather than a home birth.
Yeah.
I think, as we're going to talk about some of the things today, there has always been, I think, a movement more back to home births. I had home births, but they were attended by doctors, and I was very meticulous about us outlining the algorithm of when do I go to the hospital, because I didn't want anyone to say like, oh, we transferred too late. I'm like, the second anything looks like a red flag, I don't even want to hear anything else except the ambulance is here. That's it. Like, I just want to go. And I think that sometimes when I share that, people are like, oh, like this is a natural thing that women's bodies do, but sometimes there's just complications that are unforeseen.
Definitely. And I think it's really like smart of you to and sharing this, because you don't have to fight it. I mean, if it's gonna be fluently and it's going well, perfect. But if it's not, it's your baby's life, or if it's your baby's like brain, the oxygen that goes to his brain.
You got 90 seconds if they're not breathing to get them oxygenated again. It's
definitely
serious.
So what I love about what I do is, the way that I do it. I'm sorry, Jolene.
No, you're fine.
It's that we have the LDR rooms there, and next. And
okay, so what's the LDR room? Because you brought it up before.
Sorry, it's the labor, delivery, and recovery rooms. They rock. So that's the way it is. I'm gonna show you. So you're in labor. If it's a low risk pregnancy, then the best thing that it could happen, it's not to get induced. So your body will be ready when it's ready. It could be between 37, 41 weeks. Okay, so you start your labor at home. Okay, you start your labor. It could be with your husband or with your doula, wherever. And and when if you think you really are gonna deliver, then you go to the hospital. So the time in the hospital it shortens.
Have
right?
your partner check the app for traffic.
Definitely, you have to have.
That's one thing they can do. They can be checking the apps and be like, "What's our time to the hospital?" But you can be in your tub, and what this helps is you're in your environment, right? So your hormones are doing their job. You are not scared. You are not seeing the people that you don't know, like strangers. No, that's like a hormone disruptor. So when you think you're gonna deliver, you get to the hospital. Some of them they get 9-10 centimeters, but some of them are 1. Yeah, that's the thing. Then you get to a room, and when you're almost getting to a delivery, this is how it works in my hospital, because there are no many LDR rooms, not yet. So if you're 2 centimeters and you get to the LDR rooms, then you're going to take away the opportunity for another woman to use it. Yeah, if someone's 10 centimeters, we got to get that baby out.
So you go to the LDR when you're 10 centimeters, you finish your labor there, you deliver there, and you recover there. So everything is in one room. So what's important about this, that your baby and your partner, it's with you all the time.
Yeah.
So you are together, you don't transfer. It's a healthy baby, it's a healthy mama. You don't have to go to recovery room and separate from your baby, and baby doesn't have to go to the NICU. Right? So that gives us the opportunity to do skin to skin the first hour and all the time, because you decide to stay with your baby the whole time. So you will never get away from him or her. So you start breastfeeding. The nurses will check your bleeding and the doctors will check your bleeding there. You don't have to be separated. And everything that we already talked about, being with your baby, it's gonna make you less anxious, less risk of postpartum depression, less risk of bleeding, blah blah blah.
Yeah.
This, and I want to be really clear, we're talking about healthy mamas, healthy babies. Okay, if there's any complication, then that's why we're there.
Yes.
And we have the OR if we have to do a C-section. And we have the NICU if baby needs something. So you are prepared if something goes wrong, right?
Yes. And, I think to help people understand, because they might be like, you're a doctor, why'd you do a home birth? I did a home birth because for me, as a child, I was really sick. I had to go to a lot of hospitals. Hospitals are a very stressful place for me. And my mind, my child self that went through that trauma is like, hospitals go when you're really sick, when you're going to die. Like, this is a scary place. And so for me, I'm like, I know the state I'm going to be in. I also don't like bright lights. I don't like noises. My husband will tell you she doesn't like obnoxious noises all the time, but especially in labor, and a lot of the way, so, my son's almost 12. Hospitals, the way they were is, you're going to come in, we're going to hook you up to an IV, we're going to put in a fetal monitor, there's going to be the bright lights, suck it up, you're going to deal with it, you lay on your back, and I was like, I can't. I am having panic attacks thinking about that. But things have changed so much, and they've changed a lot in your hospital. Can you talk more about the atmosphere of the delivery room?
I definitely can connect with what you're talking about. You're in labor, and then you get to this bright hospital, and everybody just wants to talk to you and ask you questions when you're in.
That's the biggest problem. Why are you talking to me? I am having a baby.
I'm having a contraction. Stop talking to me. Yeah, I know, because I've been there. Yeah, of course. But we're being really respectful here. So you get to the hospital, the best case scenario, pretty advanced, when you are dilated.
Yeah.
So you get to this room, and the husband will give the information, or the partner will give the information to the residents. You'll have no lights, and you can...
Oh, this is my dream.
Yeah, no lights. We hate we do C-sections, no lights.
What?
Yeah, I'm going to show you a video.
Yeah.
We do no lights.
Oh my gosh, we'll have to share that somehow so everyone can see it.
I have my Instagram, and I always share some videos, but I'll give you one. So... But we're not talking about C-sections yet. We're talking about the delivery, the vaginal delivery. So
the atmosphere.
The atmosphere. I always tell my patients, get to the hospital what you feel that it's make the atmosphere what you need. Yeah. If you like a birth, like a vision birth, your snacks, your bowl, your mat, your music, your meditations, right? So you make the atmosphere like it's home. The most you can. And then when you get to the LDR, we still have no lights. A baby can come in the silla maya or in the traditional position, whatever you feel you want. You can be with epidural or no epidural, whatever. Some of them are with IV or no IV. That's my call. That depends, because every delivery it's another story. So I don't have a rule. It's a feeling thing. I don't know.
Yeah. Well, and it's also, so with my first, I was throwing up the entire time. And they would say to me, the doctors were like, if you cannot get fluids in and hold them down, you have to have an IV. So I'd get fluids down, I'd hold it down. They're like, okay, you don't need the IV. Vomit. And they're like, no. IV. And they kept doing, and I was like, I will do whatever it takes not to have an IV. Just please don't have me hooked up to anything, because I'm I just have to move.
Yes. You monitor the baby. You see how the heart rate is doing. You do a intermittent monitoring of the baby. And I think I have been really respectful on what women want because I love music. So for me, every delivery has had to have music.
Yeah.
But no, there's people that want silence. So I have learned that.
Yeah.
Silent, it's okay now. So whatever the patient wants, we don't talk between us, like me, the pediatrician, or the anesthesiologist, just to give space.
Oh, yeah.
To what it's happening. We try the less people we need in the room. We definitely have people. We have the nurse, we have the pediatrician, we have me, have my partner, or somebody that's helping me. But we try to be like really low key, right?
Yeah. So I love what you're describing here. I love this for everyone. Women who are neurodivergent, so autistic, they have ADHD, they have a past history of trauma. This is like exactly the birth setup that they need. And I hear from women all the time who are like, it's hard to be pregnant, but the delivery felt so traumatic for me that I couldn't do it again. And they didn't have like birth trauma in the way that most people think of it. It was the beep, beep, beep of the monitor that didn't stop, the bright lights on them, the people touching them over and over without their consent, without asking if they touched them. So that I just want to bring that piece up because the next question I'm going to ask you, I think this is going to be helpful for a lot of women, and is that how can women advocate for themselves to ask for this kind of scenario, this kind of situation? Because not everyone can go to your hospital and work with you. But how can they find providers, communicate with providers?
I can happily say that that's something that I can provide, and definitely I'm not for everyone or wherever, but I can see that now more and more there are people doing this kind of births in more hospitals in Mexico City. It's a really sad thing that I cannot say this about public health in Mexico. It's really, really sad. And I hope things start to change a little bit. And doctors, I know they're tired there, and they got paid like really bad. And we have to humanize and give the information to the public health so women can advocate. But if you're in a private practice and if you trust your doctor, I think it's really nice that you give your birth plan, you say what you want.
Yeah.
What are your wishes? And then just back down, like back off. Just give the wishes and
you're
trust.
saying doctor back off.
Yeah. Like trust. No, as a patient, like not back off. Like what I want to say is you give your doctor your wishes and then you trust.
So when you get in the room, you trust what's being recommended.
Yeah, if something is not going like exactly what you thought, you have to like being fluent about what is happening. But I think you have to advocate before that moment.
Yeah.
Do you know what I mean? Like being sure that you are with a doctor that it's gonna respect your wishes.
Yeah.
And if it's gonna do a C-section or it's gonna decide something, it's because it's the best for you, and it's not because he doesn't want to do it. Do you know what I mean?
Yeah. Well, I do want to talk about C-sections. So depending on where you look in the United States, the C-section rate can be as high as 38%. I was reading the C-section rates in Mexico doubled from 23% in the 90s to 46% by 2016, which is well beyond the World Health Organization's recommendation of 10 to 15%. So what's going on there?
Oh, yeah, this is, and it's awful, like in private hospitals and in public hospitals, it's 40 or almost 60%. So it's part of the system. It's part of what we talk about, like doctors being tired, or this misinformation that just doing C-sections to everyone, it's safer.
Yeah.
Or doing a episiotomy to everyone, it's better. No, I like I told you, I don't think anyone does it like, nobody like, it's a doctor to harm someone.
Yeah.
Do you know what I mean? So
yeah, you're saying they don't want to cause harm. They're doing what they think is best.
It's what I was taught to do. No? So you have to inform yourself from another way. But now there are committees and there are movements that are changing this. In my hospital, there's a C-section committee, and they say, like, why are you doing so many C-sections?
Yeah.
No? So they're starting to regulate it too. So it's starting to change. Yeah,
that's good to hear, because it is something that, so often, like, we hear the United States gets called out for it, but there are many countries that are still having high C-section rates. And I do think it needs to change. I think there's absolutely indications for C-sections. You've highlighted some of those, but when the patient doesn't have a choice, I think that's when it becomes a problem. It was interesting because I was reading that, you know, so we were talking about obstetric violence before, but that even the use of C-sections when it is without the patient's consent, it's obstetric violence. Can you define obstetric violence, or just tell us a little bit about what it is?
There are many descriptions, depends on when you read it, but obstetric violence, it's when you don't hear what women want. Yeah. Like when you don't informate the woman what you're doing. Not letting the woman being with somebody, like being accompanied, that's violence. Like shaving her and not telling her why, that's violence.
Shaving her, so shaving. Yes.
Doing an episiotomy and not explaining why, it's violence. Doing a C-section with no absolute or relative indication, it's violence. Like screaming to women. This in public health, they just scream like push, like screaming to them. It's violence. Induce a woman if that there's no need. It's violence. Not giving her the time that she needs or the time the body needs before deciding it's a C-section. It's violence. Not letting her eat during labor, that's really common, that now we know that you need the calories and you need the energy. Like leaving a woman fasting for 24 hours, it's violence. Not giving her something to drink, not letting her listen to her music or move, it's violence, right? So a lot of things are.
Yeah, and you know what I'm hearing is the over-medicalization of birth, the loss of autonomy for the patient, so their inability to state what they want for their body and need what they want, state their needs. And, you know, all of this, I think, you know, as you say, like hand the birth plan and trust, I think this is what makes women feel like they can't trust. I've had patients say that every time they go to their OB-GYN, they feel like they're going into battle, like they feel like they're going to war. And they've, you know, I think a lot of this came out of the pandemic as well. There was a lot of obstetric violence in the United States. The birth, the fetal and maternal outcomes, especially those of Black, Indigenous, and Hispanic women, I mean, it just became so jaw-dropping awful. And so I think that's what a lot of women get afraid of like, even, so I'll give you this example. There was a group of moms that I was talking with here in Mexico City. And when they were talking about how they found a doctor, and one thing they were passing around is that, ask your doctor, am I allowed to eat during birth? And they said, because if they say no, they're lying to you about the C-section, because they said so often, doctors will say, no, like you can have a natural birth, you can have a vaginal birth, like I won't do any intervention. And they're like, but they're dishonest with their patients. And once you get there, they'll say like, you can't eat because you're probably going to need a C-section. And that, when they were saying that, they're like, oh, this in Mexico. I'm like, I hear the same stories in the U.S. So I just want to be clear with people, because I think sometimes it's really easy to be like, you know, we glorify some countries and villainize others. I think everybody does some things good and everybody has some learning to do. It
depends where, but I can definitely understand this. I'm gonna share a little bit. I had my first baby in San Diego, California. I was with a Greek doctor. I love him so much. He was so respectful about what I wanted and how I wanted it to be treated. He wasn't there because it was his birthday, so I had my baby with a midwife. I had this such a great experience. You know who did the best experience for me? The nurse. Yeah. In Mexico, we don't have the role of the nurse is not that much. She checked me. She was with me. She checked my baby. And I trust her like fully. Nurses and my friends that are OB-GYNs, they were like, "How you were with a midwife and you didn't even ask if there was somebody in the hospital?" I trusted that everything was going to be fine, and it was fine. And my baby was small, but she was with me all the time, and it was such a nice experience. Okay, my second baby was born in Florida, in California, in Miami. Yeah. just because I wanted to be in the summer there with my daughter. And then I had such a bad experience. I chose a bad group of doctors. They wanted to induce me like every day. Like, no, let's induce.
Yeah.
If you were my daughter, I'll induce you. And I'm like, why? I understand the ultrasound. Why do you want to induce me? I don't understand. Right? So it was such a different experience, and I had the vaginal birth. It was really painful. The things didn't go as I planned. I wanted the shower. The water was cold. They told me I needed the IV right away. Many things, they weren't like I expected. So it depends.
Yeah, but I just want to point out that you are a doctor, and this was your experience, because I've shared with my followers and listeners some of my experiences with doctors, and it is always something where it's like, if we struggle to navigate these situations in healthcare, how much worse is it? You knew
I know
how this should go. How much worse is it for the average
sometimes, you know what I
patient?
think? That ignorance is bliss. So sometimes I didn't want to know anything because that made me stressed. But I know what you mean, of course. And I know how as a patient, not being a doctor, can know if the doctor is saying the truth. The thing is, we shouldn't even think that they could lie, that shouldn't happen.
No,
we just it's hard. It's the world.
It's interesting that you brought up Florida, though, because I have during the pandemic, I had 2 friends who birthed in Florida. Their husbands were pushed out. They had episiotomies without consent. There was major obstetric violence, and I told them that. And I was pregnant later, and being in Puerto Rico, I was going to go to Florida. And after hearing that, I was like, no, and that's actually why I ended up finding the group I did in Mexico, that, everything they were about. And I think that can be so challenging because based on your location, it can be so limited, especially right now in the United States there's so much happening in terms of laws in reproductive health where gynecologists are leaving states. And so it becomes even trickier. And I just want to honor that because, you were honoring how some women have access to only public health here, and that's not the best system. And I think it's very true. A lot of women in the United States can resonate with that access as well.
But I think that these places, when we can speak out and people can hear, we're starting to change something because it can permeate to more people that can make a bigger change, more than me, more than what I do, more than my little private practice, more than.
Yeah. Well, you've known me for a bit, so I've always said share your story, because I think sharing your story is healing, but I also think it's how you create change. And when enough women start to recognize they're not alone, this is not their only experience, and they start speaking up, it's when doctors, medicine, the entire system starts to be like, we have to do things differently.
I think that when you're passionate about what you do, and you do it with your heart, and you do it and you do it with love, then you do it right. Mm-hmm. And I want to be and I want to say this, and it doesn't matter if it's a vaginal birth or if it's a C-section. And I have had patients that say, I would rather had 30 C-sections being this way than many other vaginal births this way. Do you know what?
Yeah.
Like the love that you put in, the intention that you put, how you take care of the babies and the mothers. I love what I do. My father is an OB-GYN, whatever. So I was raised with this. I went to the hospital. As for you, the hospital is a bad place. I love the hospital. Yeah. For me, it was always fun. They gave me candies.
Well, if you're getting candy, I got barium swallows. So
they gave me candy. So for me, growing up, it was part of my life. Mm-hmm. Then my parents got divorced, and I just messed. I didn't know what I want to do. I never grew up as a child that knew he was going to be a doctor. Actually, so I studied marketing for 1 year and a half. And then it didn't feel good. Mm-hmm. So I switched to medicine. My parents didn't want me to. Then my mother, she supported me, and I'm here and loving what I do. And
Yeah, well, we're so glad that you are. I want to ask about justifications for C-sections.
Yeah.
We talked about, when the placenta is covering over the opening of the cervix, we cannot deliver the placenta first because baby would lose oxygen. Mm-hmm. What are other justifications for C-sections? And I'm bringing this up too because I think sometimes women feel like if they had to have a C-section that they failed in some way, and I don't think that's true, and I don't think women should have that mindset. But as a mom myself, I'm like, I've done plenty of my negative thought process about many things about motherhood as well. But what are the reasons that it's like, yes, this is going to be a C-section because this is the best thing?
I think it's really good for you to honor that feeling because they all feel they failed.
Yeah.
Now there's this social movement that we all love vaginal births, and so if they cannot have it, they feel they're failing to their babies. You are not failing, never. But yeah, let's say sometimes we get to 10 centimeters, because there's no way to know if baby's gonna come out just if you don't try.
Yeah.
This thing that they used to do before, they used to take some pelvimetric measures with a like with an X-ray.
Yeah.
And they said, no, your pelvis is too small or the baby's too big. That we don't do that anymore because we know relaxing and when you get in labor, things change and it keeps open.
And radiating babies is bad. Let's not do that.
Yeah, but there's no way to know. So sometimes we do get to 10 centimeters and babies are asynclitic, so they are...
Yeah, their head's tilted to the side.
Yeah, so that's a thing that you don't know until you're there. When the placenta rips, how do you say?
Ruptures.
No, that's the uterus.
Yeah.
If you have a uterus rupture, when you have a previous C-section, you can have that risk. So you have to do a C-section immediately.
Yeah.
No, placenta.
When it starts to separate.
Detached.
Yeah.
Placenta, when it's placenta detached, that's an emergency C-section. What else? When you have a preeclampsia that you cannot control, you can induce definitely. But if you cannot if you're not able to control everything, then you can. But actually, you can induce. You can do a vaginal birth with a preeclampsia.
With preeclampsia, though, there are sometimes emergency situations. What does that look like for people who are not familiar
HELP
with it?
syndrome. Do you know what it is?
Yes.
The HELP syndrome, the platelets go really low, and the liver gets inflamed.
Yeah, the enzymes shoot up.
The enzymes shoot up. So you have a high risk of having a liver rupture, and that's.
Yeah. Yeah. We don't want to lose any vital organs. And with the...
No, we don't.
Yeah, and that's why, there's VBAC, having a vaginal birth after C-section. And I think sometimes, women, they get really upset because they go for that as well. But, they're unable to. They end up having a C-section. But understanding that a uterine rupture can be it can cost mom and baby their life. And so it is something that it's like, I think a VBAC is always like wonderful if you can achieve it. And at the same time, if it's just not the path you're meant to walk, then, I think that's sometimes how I look at things that didn't go the way I wanted them to in birth, of like, well, that was the path that I thought was for me, but the path I actually walked, it taught me a lot and it got me my healthy baby.
Of course. Yeah, and the VBAC is awesome. You have to be just having the things that are secure for you. Doing it in a hospital, the time between one baby and another, it's really important. So you can be safe.
Yeah.
Having more monitoring. Course. I do put the epidural when it's a VBAC. I don't put the anesthesia, but I do put the catheter.
Yeah.
So what I say is, if you don't want to have anesthesia, that I have had VBAC with no anesthesia, just having the catheter. So if I have to do an emergency C-section, I don't have to put you down.
Yeah.
So you can see how your baby gets born.
Yeah.
And I think that's really important. So if you have the secure measurements, you can do it.
Yeah, that is beautiful. I love that. Healing after a C-section, what are the things that you recommend for patients? And again, you have just a very patient-centered perspective of things, and so that's why I really am interested to hear about after C-section. What should people expect for recovery, and what can they do to help their body recover?
I think general postpartum, like vaginal birth or C-section, like be really patient with your body. Right now, there's a whole movement of getting out from the hospital and having this wonderful body and start doing these breathings and these exercises. Please don't.
No.
Please give yourself 6 weeks.
Yeah.
For your body to do its own. Feed yourself well. I think that bone broth is great for postpartum. Warm food is great. Ask for help. Ask for more hands. Your mothers, your mother-in-law, your husbands. Sleep. My best advice is sleep when you can. If baby's sleeping, sleep.
Yeah.
Be aware that your hormones are a mess. So these few weeks, you're going to feel so vulnerable about anything. Because you're going to cry because your baby's beautiful. You're going to cry because you heard a song. And you're going to cry because you had a C-section or because you had a vaginal birth and you're swallowed. So be patient put a step back and look at you like if you were out of you. You know what I mean?
Yeah.
Hydrate yourself for a nice breast lactation.
Yeah, milk production. Yeah.
I think that a really good advice is have a breast lactation consultant. I think that it's really important. Having a lactation consultant checking the latch of your baby, it can be really important for you.
Yeah.
So stay calm for these 6 weeks. Don't start exercise or anything. Just eat and drink water and sleep and wait for your body to recover.
How important is breastfeeding in your opinion?
For me, I try to encourage breastfeeding because I think it's really good for babies. But peace of mind for the mom, it's the most that I encourage. So I love breastfeeding for the many, not qualities, but for the many benefits that it has for the baby and for the mother. But in these years, I've seen mothers struggle so much too. So now I say whatever it gives you peace. That's why I like to work with a lactation consultant. So it gets easier. So you are informed and you know these first 6 weeks is going to be so difficult for everyone. My husband says that it's like a nuclear science with breastfeeding. So,
and I think the lactation consultant is important, I think, for any birth. So no matter how many children you've had, it's so interesting because, before I had my second, there were so many patients who would tell me first 3 births, cakewalk, breastfeeding easy. 4th birth, so difficult. Couldn't get a latch, had all kinds of issues. Next person's like, first baby, everything was easy. Second baby, difficult. Third baby, it was just the breastfeeding. And every birth was so different. With my son, my first, I was like, breastfeeding is the only thing I felt confident about. Because I had seen it so much. Everybody breastfed around me. So I was like, I saw it. I know I can do it because I saw my family do it. And that was it. Like birth, I was like, I have no idea what I'm doing. And then with my second, so my first was easy. My second, I am so glad that I got a lactation consultant. Like my doula was a lactation consultant. And I just called her up. I'm like, can you come over? Because this hurts so bad, and I know it shouldn't. And she came over and she was like, oh, just the way his mouth is, and there was just like a few little things. So easy. But to think so many women out there, they struggle or they stop breastfeeding because they don't know that it's something that you can fix so easily. Yes.
Right? Or having the nice latch or the positions or the timing or avoiding mastitis or many things. Yeah.
Oh, what are your tips for avoiding mastitis?
Breastfeeding the baby, not passing so much at the beginning, like not doing this whole night of sleep because then you can
engorgement is real.
Exactly.
Yeah, so definitely feeding more often when somebody does get mastitis. Like, what are your tips for?
I love them to get to the shower and get this hard soap, this, and massage their breast from the outside to the nipple, and just like dissolve the
basically the
balls, yeah,
blockage.
the blockage.
I'm like, I want to say clot. That's not the right word, but it feels like clotted milk in there.
It is. So yeah, a lot of massage and warm in your.
And then what about, like, when should they definitely call their doctor? Because there is a time and a place for antibiotics.
When they have fever,
yes,
definitely call the doctor. If you have fever and if your breast is red and it feels really warm or hot, I don't know what's the word, then call the doctor. Sometimes you do need the antibiotic and it's okay.
Yeah.
Take probiotics in your when you're breastfeeding. It's good for you and for your baby.
Okay, I love that. And what about nutrition? Now you're postpartum, you're feeding a baby. What should women know about
There's
their
something that
nutrition?
it's magic. The milk is magic because it doesn't matter what you eat. The milk is perfect. That's something we know from years. So it's not that I'm saying that you don't have to eat well, but you have to eat well for you, not for your baby.
Yeah. Well, there's a lot to recover too.
Yeah, definitely. If you eat badly, if you eat just like garbage, then your milk is gonna be perfect because we are the human body. It's awesome, right?
Yeah.
But you have to feed well because you have to recover. You need iron, you need vitamin D, you need vitamin E, you need omegas, you need calcium, you need so many things for your recovery. You did so much these 9 months, and giving birth, it replenished yourself. It's. Did I say it fine?
You did. Replenish yourself is right. I think it's it's something that's really troubling is that, there's been research showing that women go into pregnancy nutrient depleted as it is. They don't have enough nutrient stores. And then, when they come out postpartum, it's just this race to try to recover. And so it's why, it'll be recommended to stay on your prenatal, especially if you're lactating still.
Of course.
And being really mindful of your diet, because we know that, 20, 30 years, 40 years maybe, you could have higher risk for osteoporosis. Like there can be other issues going on.
Your diet, your supplements, eventually your exercise, your sleep, and your mental health.
Yeah.
Your community.
Yeah. And I want to say, I just love that you're like, whatever is best for your piece when it comes to breastfeeding, because there's a movement called Breast is Best. It's irrefutable. Breast is best.
It is.
And people
but
have
not
said,
for everybody.
Yeah, but people have now said fed is best. And it's very interesting to watch how formula companies have now infiltrated that to be like, yes, fed is best. And I'm like, you guys are why we had to do the breast is best movement. And so it's just so tricky for, I think, people to navigate because there can be so much judgment. So even though people say that online, still if you're breastfeeding in public, people might be judging you. So you feel that judgment. And for anyone listening, I don't think there's any aspect of being a mom that you don't get judged for. And we all feel that. But I just really think it's so important because sometimes breastfeeding is so easy and sometimes it's so hard. And sometimes it was never possible to begin with. And I think you just have to honor where you're at. I've certainly seen patients who are like, for my mental health, I cannot continue to breastfeed because I am not a good mother.
And I applaud that too.
Yes, to recognize it. It's so brave.
Because you have this social pressure. And you said it perfectly. Yeah, definitely breast is best. Of course it is. But everybody's different. So you have to acknowledge what everybody's living. Yesterday, a patient that I love, she called me. She had a first baby. She gave that baby a year, okay? And now it's she has a 4-month baby, and she's struggling with mental health.
Yeah.
So she needs her hormones. She needs to ovulate to feel better. And she was struggling of, what do I do? But I feel bad, but I'm not a good mother. But how can I give him a year and I'm gonna give her 4 months? And I said, she needs a healthy mother.
Yeah.
So stop, and it's okay.
Yeah. It's absolutely, I think that there are so many times in motherhood we have to pause and give ourselves permission to recognize that I'm actually a better mother if it's this way. So I'm somebody that let my house be a mess. I'm getting in bed at 8:30. I have to go to bed at 9 o'clock. I'm not always so great about this, right? It's like sleep is best, but sometimes I don't always do it the best. So I have to get quality sleep though, and I have to exercise. Otherwise, I'm irritable, I'm short, I have less patience with my children. I don't like who I am and how I show up in the world. And so I have to recognize that. And I think, and that's just like one example of like how I have to like forgo some things and I rearrange my life for it, but I will let my house be a mess and people might have to go without underwear if it means I sleep. Like that's the way it has to be.
That's your priority, and it's fine. Everybody has their priorities.
Yeah.
For me, exercise, it's a priority, and being with my children and trying to balance my work with being a mother. Everybody has their priorities.
I'm talking about sleep to like an OB-GYN and you're like, what sleep? It's really like I was...
No, it is important for me. I try to hack my sleep as much as I can.
Yeah.
Because, I don't sleep that much. So what I sleep is great. I'm a great sleeper.
That's fantastic. And that's, I think, always the troubling thing when you have a baby and you need to sleep and you're so tired, but you get into this cycle of having difficulty sleeping.
That's the worst.
Yeah. How can you help moms with that?
That's the worst. The worst you can do, it's not sleeping. And sometimes you get so anxious.
Yeah.
Even it could be during pregnancy or it could be postpartum. It's something that you're anxious. So you can't sleep, but you have the time because baby's sleeping and you can't.
Yeah.
So talk to your doctor. There are some natural things that I give my patient, like passiflora and valeriana, or something that are like
passion flower and valerian.
Yeah, that's passion
flower. Do you
flower.
use those in pregnancy or just postpartum?
Postpartum.
Okay.
Oh no, I do use them in pregnancy actually.
Yeah.
I do. When they're anxious, I do.
I love passion flower.
I do.
And so for people listening, passion flower
and sometimes I give them, it's the last thing I do, but sometimes I do give them melatonin when they are like really having a bad time. And sometimes we have to go with, you have to check your thyroid. That's really important. If you're not sleeping after the baby's born, you have to check that there's not a thyroid storm, okay? That you can get some like hyperthyroidism. Hyperthyroidism.
Yes, which give me, so with postpartum thyroiditis, it's the classic picture is hyperthyroidism. So you're anxious, you can't sleep, then it drops to hypothyroidism.
Exactly.
And usually we see breast milk supply drops, and then that's it tends to correlate too around postpartum depression. So I love that you bring up the thyroid. What I was going to say about the passion flower is it stimulates GABA receptors in the brain, which is exactly what the metabolites of progesterone does. So when you don't have your progesterone, because often people will say, well, why don't you just give progesterone as soon as someone has a baby? And I'm like, because they have to establish their milk and like trust. You don't want to mess with that in the beginning. But passion flower can be really great for that. And because GABA helps you stay asleep.
I love magnesium too.
I love magnesium. And the other thing I really like too is collagen, because it's high in glycine. So I find that, sometimes with patients, this especially happens in like perimenopause, I swear, perimenopause and menopause, and then postpartum. It's like these the things that work.
Yeah, they're similar.
But like having like collagen with like in a turmeric tea with like a little bit of honey before you go to bed can help with sleep, but help with your hunger so that you stay asleep. You don't get the cortisol spikes at night. I love magnesium as well.
I love magnesium too. In pregnancy, in postpartum, like in every part of your life, actually.
Yeah. Well, magnesium, it can help with prevention of preeclampsia. It's not to say, I want people to understand supplements, they are not a treatment for medical conditions and they can't prevent everything. But we know that low magnesium can be associated with like headaches, with blood pressure issues. So, and then it definitely can help with sleep.
Cortisol management, stress management, having a good night's sleep, going to depends which magnesium, and you talk about that a lot, but it's important which magnesium are you taking. It helps to regulate your bowels too, because when you're pregnant, progesterone will just make all your bowels ring slower. So.
That's where magnesium citrate is your friend, and then you can switch to the glycinate, which and some people will take a little bit of magnesium in the morning. Citrate helps with their bowel movements, and then glycinate at night, and that helps them sleep. But and it's also great for brain health. So if it's great for an adult's brain health. It's got to be great for babies' brain health. I actually haven't seen studies on that. And now I'm like, I'm very curious. I need to go
Me
look
neither.
that
Let's
up.
check that.
Yeah, I'm like, have they studied that
Let's
yet?
check that.
Yeah. It's always tricky, though. So often people will say, like, we don't have great human studies on this. I'm like, because it's unethical to be like, let's not give moms magnesium their entire pregnancy and just see what happens to baby. Like,
Exactly.
no, let's just, and we always start like food
That's the thing
first,
that
then
happened with
supplements.
alcohol, right? That
Yeah.
we don't know where's like the...
Yeah, okay, so let's talk about that because fetal alcohol syndrome is a very scary thing. Oftentimes women, they might not even know they're pregnant. They've been drinking alcohol. So if somebody is like, hey, I had a glass of wine, I tested like a couple of days later, I'm pregnant, should I freak out?
No, you shouldn't.
Okay.
There's a thing called the rule of in Spanish we say it's nothing or everything. Okay, this rule. So if you had drugs and alcohol, like binge drinking, and you didn't know you were pregnant, if it's gonna affect the baby, you're gonna lose the baby. If it wasn't enough to affect the baby, then the baby's gonna come fine.
Yeah.
Right. It's
And
not
this
gonna,
is early. This isn't like third trimester.
No,
like-
really early.
Yeah.
But you're gonna have like a damaged baby.
Yeah.
Either it's gonna be there or it's not. That's the way it is. So if you drank or you drugged, then if the baby's there, just stop. Okay. What I can say about alcohol, it's like the responsible thing. It's not alcohol in pregnancy because of the fetal alcohol syndrome.
I'm curious, what were you taught about postpartum care for moms when you were in school?
Not much.
Yeah.
Not much.
Was
Maybe
it just check
maybe
in
nothing.
6 weeks and they're done?
Yeah, I did have a class or two about postpartum, and especially not a physiological postpartum, like a pathological one.
Okay.
Like what if she has mastitis or IUD? UTI. Yeah.
The other acronym down there.
Yeah, but there's so much to know and to do about postpartum. It's such a special time on women's face.
Yeah.
I wanna say something that I think it's important for women to hear. For me, it's really important the mental health in postpartum, and I do want to acknowledge that postpartum depression, it doesn't have to be right away when babies are born.
Yeah.
You can have postpartum depression the whole first year of your baby. You can have an 8-month baby and start your postpartum depression. So that I think that's something that nobody talks about. There's more and more information now. We know that everybody has baby blues for 2 weeks.
Yeah.
It could be, it could feel like more one woman to another, but the hormonal things, it's the same for everyone. You just have no hormones.
Yeah.
So this brief menopause, it's gonna make you feel like you don't even know where are you. So passing that, if you're feeling sad or you're feeling like you don't want to be with your baby, or sometimes that you want to harm your baby or yourself, you have to ask for help.
And intrusive thoughts, having thoughts that really impose on you that are not your own, that are scary as well. I think sometimes women don't recognize that. And sometimes, as you were saying, what looks like hyperthyroidism can actually be the way your depression's manifesting. So I always think it's best that if you can find somebody to work with while you're pregnant, find a mental health provider. And then if you don't need them postpartum, you don't need them. But if you do, it's so much better when you are feeling that in that dark place, that place of panic, that place of loneliness, that you already have somebody instead of having to scramble and then also find somebody. I appreciate you speaking to that. How common is postpartum depression?
I think it's more common that I want to say that
Than we recognize.
how much we recognize or diagnosed.
Yeah, no, I definitely agree with that.
I don't know, it's 6 to 10%, I think. Maybe somewhere around that.
I think it's also not that, it's not only just that we're missing diagnosis. I think it's also very shameful. I know in the US, the culture is that you're a mom. You can do it all. You should be able to do it all. You're a super mom. Like you can, go back to work at 6 weeks and be separated from your baby. You can manage the entire household. You can keep doing all these things. And in the reality, like I was saying, my kids don't go without clean clothes or things like that. But like I was saying, if I have to let some stuff go, I let some stuff go because mentally I know that's what's going to be the best for me. But I don't think we have these conversations enough. It's again, we feel like we're a failure. We feel, and I felt that a lot more with my first, but honestly, I think having the privilege of listening to so many patients' stories, that's how I knew I wasn't alone, that I wasn't a failure. It wasn't the only one, because I was like, my God, when my office door closes and the stories come out, it's like we're all having these struggles, but we're not talking about it because we think everybody else has it together. Especially I think in the social media age, there's the highlight reels on there, and
everybody that follows me, they say, wow, she has two daughters and she's doing this, she's being in the hospital at 3 a.m. and then she goes to the gym and then she's with her daughters, and then like if I'm a rock star, I'm not. Definitely I'm not. I'm just a human being. I had postpartum depression. This is the first time that I'm saying that. I had it with my second baby. It was really hard for me to recognize, and it was really hard for me to get help because I felt like no, this is not happening to me. I'm an informative woman. I have a team. My baby's healthy. Everything is fine.
Yeah.
Why am I feeling like this? And it wasn't the first month. It took me 10 months to recognize that I wasn't okay. It took my husband to push me to say something's wrong here.
Yeah.
And it was really hard for me to ask for help. I asked. And I'm getting out of it. I'm feeling pretty good right now. My baby is 1 year and 2 months, but it was a traumatic delivery. So that took away the joy, and physically it was a challenge. Yeah, I had to go around the world to look for a doctor to fix my what I was feeling in my perineum area. I had a nerve that was damaged. It's really what happened to me. It's not something that's common. Obviously, it had happened to me. It was really weird. So I had damaged a nerve that it's called pudendum nerve. So I couldn't sit for months. And I'm an OB-GYN, and I didn't know, and I haven't seen any of my patients going through that. Yeah. So I was having this physical struggle that went to my mental health, obviously. And I was in pain, and I was working because I had my patient waiting for me, and I love to work, but I have a baby that needed me, and I was breastfeeding, and I had my toddler and life. So sometimes it's a lot, and what I do in social media, and sometimes it's a lot. So I had to close my agenda, to take a step back, to lower the patients that I saw for this year, and to take care of me. Yeah. Because if you as a mom you're not well, then you cannot be well or fine for anybody else.
Absolutely. Well, thank you so much for sharing that. I mean, I'm really touched that you would share that here. I think it's going to help a lot of women to hear that. And that nerve pain, anybody who has chronic pain is at risk for depression. Yeah. We know this, and this is even an area of medicine really neglects people in chronic pain. And so adding that on top of the demands of being a mom, and then the hormonal changes and how they affect your body. I mean, it's so much for any one person.
It is. But thanks God, my mantra is everything passes. So right now I'm feeling much better. I can sit, as you see. I'm not in pain anymore.
Yeah, I can relate, not to the same extreme, but after I had my second, I ended up having a psoriatic arthritis flare, and it was mostly in my sacroiliac joint. Okay. So sitting for breastfeeding, I couldn't lay down, and there was this big conference that's like it's a really big conference in the United States, and it's so prestigious if you can speak at it. And I was supposed to go speak, and I was like, I can't sit on a plane. I cannot walk in an airport. I can't walk on a stage. I can't even get comfortable in bed. And that was something that was like, I went through that for probably a good 6 months of that pain. But that's, you know, it's the same thing of like, I had to say no to that conference. I don't care how prestigious it is. I have to take care of myself. And I don't think my 20-something-year-old self would have the wisdom to do that. I will just say that. Like, I think I will say I had one son at 31 and I had the second at 40, and I just love who I am as a mom, as a person at 40, my boundaries, all of it. But I think it is really hard for all moms. And it's also just something too that like, I want to emphasize your message of like taking care of yourself, examining where you need to dial back so that you can care for yourself.
I think that in the US you have more information about postpartum depression, and there are more red flags. You go to the pediatrician, and there's like this
they do screening,
They do screening, and here we don't. Mm-hmm. In Mexico, we don't. So I think it's important we start doing something about it.
Absolutely. That's really unfortunate that that's not taking place. And especially because sometimes interventions as simple as getting community, getting support, getting outside in the sun, getting exercise, those can benefit women. But for those who definitely need the higher level interventions, like needing pharmaceutical support, needing, to have therapy, it's just really unfortunate. For what I think most about is that it's unfortunate for their health, but it's so unfortunate because they had a dream of motherhood and they're not able to have that dream and to experience that and live that in the way they desired.
And this is not my case, but I do know that there are many women that they cannot connect with their babies right away. So they feel awful about that. And I want to say that's normal too. Yeah. For some, it takes time to connect with your newborn. Mm-hmm. So give yourself the time. You don't have to love him with all your heart when he's there just at the first sight. Yeah. For some of us it is, but for some it's not, and that's normal too. It will develop with time.
And it's also normal for dads too.
No,
and
it's
we
much
hold,
more.
Right? And we hold space for that. And we say like, oh, it'll take them time to develop. But for moms, they're like, it should be instant. You grew them in their body, therefore it just should be instant. And so I appreciate you normalizing that.
Mm-hmm. Yeah, definitely for dads it's another world because there are so many studies that you can see in the MRI, how you change your brain being pregnant, and they just don't. Yeah. So for them, they need for the baby to start doing to connect with them and start smiling or start doing something so they can connect. And for us, it's different. But
can you talk a little more about how the brain changes in pregnancy?
Yeah, I exactly like what grows, if the how do you say the pituitary gland.
No, pituitary gland. Yeah.
Exactly the changes. I don't know. I know it changes. There are many studies they can show you in the MRI how it grows and how the connections are different because your hormones are different. Yeah.
And the pituitary being the master gland that's really signaling. I mean, it's the general, right? That sends out. I don't like war analogies, but it feels like, the military system is so well organized, like our body. I think that's where it always comes out. But it's like, the person, it's the CEO. We can use that gives all of the signals to the hormones so that they can operate. And I've seen recent research, forever women have said, I have mom brain. And this feeling that the brain changes in pregnancy and into about 6 months postpartum. And forever science, medicine, they were like, no, you silly ladies, like you're just being scatterbrained women. And now there was actually a doctor who did MRI studies on herself.
It's 10 years, right?
And it showed, significant changes. And I will say, I have noticed for myself, but also my friends and I have talked about it, how much better we are at multitasking, like how much better our brain got after pregnancy. I always wonder, like, did my son send some little stem cells up to my brain and they're like, little patchwork, make it stronger, Mom?
We can talk about that, the late clamping of the cord and the stem cells.
Yeah, tell us about it.
I want to tell about you that. I want to talk about it. Okay, so when baby's born, if you do late clamping of the cordon, then you have these stem cells going through from you to your baby. So these stem cells can go anywhere your baby needs them. Mm-hmm. So I think it's great. There are some researches that says that they have more blood. The 30% of the blood of the baby, placenta keeps it.
Yes.
Okay? So if baby is born and you cut it immediately, then you don't give that 30% that it belongs to your baby. If you do the late clamping, then you pass this 30% that it belongs to the baby. So you have more blood, you have less risk of transfusions, of anemia, of I'm gonna say in Spanish, it's called enterocolitis necrosante. It's something in the
intestines.
intestines.
Yeah, enterocolitis.
Enterocolitis, yeah. And they say that you have more blood, you have more oxygen, so then you have more IQ.
Yeah.
The IQ is higher. And the stem cells that for me are so important.
Mm-hmm. Yeah, I love that you bringing that up because they have done studies showing that iron deficiency, anemia, infants, children is associated with lower IQ, and breast milk is not going to give you iron, which is by design because it could feed harmful organisms in baby's gut, which would be bad. So this is the brilliance of the body. As you were saying, breast milk will be made perfect. And that's, where it becomes so important that solids do come in around that 6 months. There's some people who are apprehensive about vitamin K shots, about giving baby vitamin K. Can we talk about that? Because there's the drops, there's shots. What's your opinion?
There's more. That's more like a pediatrician thing to do. They decide, but we do. In my hospital and my patients, we do give them the vitamin K shot. Yeah. It's because we lower the risk of brain hemorrhages when they are born. They go through vaginal canal, so they can have an hemorrhage. So if you're giving the vitamin K, you're lowering the risk.
Yes, and a hemorrhage is a brain bleed for people who are
sorry.
No, it's fine. And that I do think, there's some people, and, people are going to make in their decisions based on the best information they had. I definitely am like vitamin K, you are not going to get enough of that in the breast milk. You're not going to get enough of that immediately. And any kind of bleed, any kind of hemorrhage, so brain hemorrhage, yes, because you just came through the canal, but even in those early days, like it would be so heartbreaking to skip such a simple intervention and then to experience loss. I do think
it's really important too. I think that there are some interventions that they have to be done, and it's okay, and it's not to harm your baby.
Yeah. Vaginal recovery. We talked about C-section recovery. You talked a little bit about postpartum, but then you did bring up the swollen vagina. And we've all had, if you've had a vaginal delivery, then when you're like, has my vulva always been so big? What is happening? And then for people who are like, wait, vagina, vulva is the inside, vulva is the outside.
Yeah, the vulva gets really, really, really swollen, and the vagina too, and that's normal. It will go away, don't worry. The first 24 hours, if you can do ice pack, it's really good. Like, don't do the K-pads that they are cold and they stop being cold 10 minutes after. Use really the ice pack. When the ice can burn, don't burn your skin.
Oh yeah, have a barrier between the ice and that, so you don't burn the skin.
Do use the first 24 hours ice pack. That will help a lot. It depends if you have an episiotomy or if you didn't, but if they got stitches on you, just be really, really careful with your hygiene.
Peri bottles.
Peri bottles, I love.
I'm like,
they're the best.
I think even after you have a baby, you're like, okay,
still use them.
The Peri bottles are amazing. I don't know. I'm team bidet. So when I travel, I'm like, Peri bottles. They're
in Mexico,
so great.
We don't use so much.
Yeah,
we don't use so many Peri bottles, but they are great. So I'm gonna explain if people don't know what they are. So when you just had a baby, when you go to pee, it really hurts, right? It feels like it burns.
Yes.
So you use the peritibral with warm water, and it helps you not to feel that pain or that burn. And sometimes it helps you to just to go to pee, because for some women it's hard for the first time to go to pee after you had a baby. Your bladder, it gets like inflamed, and it's not responding.
And you're also scared.
And you're scared.
Peeing and pooping the first times, you're like, oh my gosh, is it gonna be okay?
It's gonna be, I promise.
So the peribottle
stool softener.
Stool softener.
Great advice. C-section or vaginal birth, stool softeners always on our side.
And that's also have the magnesium citrate by your side for because I think stool softener is great in the beginning. Magnesium citrate can be a little later on. The other thing I love is that I make a tea with calendula and different healing herbs.
Oh,
and
that's
then
great.
I pour it onto pads and I would stick them in the freezer. And so I'd freeze the pads. And then as they were defrosting, it was like this herbal infusion.
Oof. Do you know what I love? The witch hazel.
Oh, yeah.
The witch hazel pads, those are great.
Especially if you have hemorrhoids as well, which almost everybody gets hemorrhoids. I think it's another thing we don't talk about, but people are like, oh, it's because you strained. And it's like, well, maybe, but there's so much blood and so much pressure in your pelvis as it can happen.
Yeah, witch hazel, it's awesome after giving birth.
Yeah. And then in terms of, are you familiar with vaginal steaming or yoni steaming, some people
I
call
do.
it? Yeah. What do you think about that?
I haven't done it really. I know I have heard of it.
Yeah.
Do you have any experience?
So this is
I have heard it for endometriosis.
So we actually had an episode with Dr. Ram Cabrera, and we were talking about the yoni egg because people are saying oh, you can cure endometriosis if you use this yoni egg. No, you can't. But then we talked about vaginal steaming. And I was saying that, I had patients who had used it. People would ask about it. I'm like, culturally, I'm very much don't disrespect people's culture, and then just talk them through safe ways. Steam burns are real, but they have common sense, right? They're not going to worry. We don't worry about that too much. But it was after the birth of my second that I had a granuloma, and it just hurt. Even peribottle wasn't getting me by. I was like, I have to do something to get some relief here. And I was like, I'm just going to try this vaginal steaming. So I just got this little tray that goes over your toilet. You put hot water in there. The best thing. It was so helpful and so soothing and so relaxing. And so I think that's part of why people say it helps with endometriosis, is because it is just so relaxing. But it is something now that I'm sitz baths have always been a thing, to do postpartum, sitting and alternating hot and cold.
The thing is just you have to be cautious about infections.
Yes.
That's the thing.
Not full bathing.
Exactly. Exactly, because everything, the uterus opened, so you have high risk of a bacteria just to get inside. So that's why it recommends when after having a baby not to do bathtubs or jacuzzis or pools or anything for 6 weeks.
So a sitz bath is for the vulva only.
Exactly.
Yeah, just really shallow, just for people listening. I'm I should clarify that. It's not a bath. It's you're just sitting in very shallow water to get it on the vulva.
That's okay.
But the vaginal steaming, I was just really surprised at how much it helped and how good that felt.
In Mexico City, I don't know if you know, there's something called cierre de cadera. It's the closure of the hips.
Yes.
It's a spiritual ritual. But I do recommend it always to my patients, and I did it too. So there's a doula for postpartum. It goes to your house, and she does a really nice massage, and they close your hips and your body with a rebozo, and they do a steam it's like a little sauna. Like they do like a little teepee.
Oh
in your
yeah.
bed,
With your just head is out.
with so many herbal remedies, and you just breathe it out, and you take a tea, and it's a really nice thing to do and to try. I think it's a nice closure for your body and for your soul.
Yeah, that's beautiful. There's also the practice of 40 days being off your feet. Like you're taking at least a month off postpartum. We were talking off camera, and you brought up that you had tried the yoni egg. I have not experimented with the yoni egg, so I'd love to hear it. What was your experience?
It was hard for me to get pregnant. I mean, to have my daughters, because at first I had infertility issues. It's not that I couldn't get pregnant, but I was losing them. I had two miscarriages. So when you're living that, you do anything, just to be a mother. So
I'm in that journey right now, and literally anything.
So two of the things that I did was I tried the yoni egg just to be in contact with my fertility, with my woman's side. It's more, I did it more on a spiritual side than a physical way to heal.
Yeah.
And I don't know if it helped, but I have two daughters. And actually what I did, it's a ritual that after the second miscarriage, I just, the next menstrual cycle, I just kept my blood and I diluted it with water, and I spread it in the garden, and I put some flowers, and I was there sitting and listening to some mantras, and I just cried out like to the Pachamama how bad did I want it to be a mother, and after that I just got pregnant for my daughter. So I think it's important. I mean, if it's something that you believe in, and many of us have different beliefs. I'm Jewish, so I did pray as a Jewish woman that I wanted to have a baby. So, but I have my spiritual side, and I think that when you can combine this medical part, these scientific things that we do, with this with this spiritual side that it's intangible, things get better. That's what I like about the magic of the births and the pregnancy, and being in touch with so many women all the time. So.
We've had a lot of guests echo the same thing. I'm right there with you. I think the best approach is to marry the science with the spirituality, and whatever that looks like for you on the spiritual side. We are absolutely spiritual beings, and it is a part of us that needs to be honored in some way. Yeah. There's so many people that are, criticize the yoni egg. I've had patients say that, after being sexually assaulted, it reconnected them to their pelvis, to their root chakra. There's so many other reasons outside of people will say it does nothing and there's no scientific evidence. But it's when a patient tells me that she used this and she healed her trauma, or she used this and she became pregnant later, it was part of her journey. Who am I to say that I know better than the spiritual realm, than a god, than anyone else? And who am I to tell her, there's no science there. No, and it's not real.
If it doesn't harm her, why not? If it helps her, great. Whatever you think it's good for you. And that's the same with being a mother and with being pregnant. And so.
You said the spiritual aspect of birth. What does that mean to you? You said I'd love being a part of it because of the spiritual aspect. Say more about that.
I think that just somebody that has delivered a baby, or being around the delivery, can understand what I mean. There's this magical feeling, and the whole ambience it's so strong.
Yeah.
Didn't you feel it when you gave birth? It's.
Yeah.
It's so strong. Sometimes I have to just go running or do things because you can have all this energy.
Yeah.
The energy of life.
And that's, I think, such a great way to really wrap this conversation. I just think about how we started out talking about this patient-centered, this the humanity of birth and recognizing that it's not just a medical event, but it is the welcoming of a new spirit, a new being, an entirely new person to this planet, and that is happening through the gates of the mother, however that looks like in the birth room. It is such a magical and beautiful thing.
Yeah. And I do want to say how much I admire you, because
thanks.
everything that I do in the birth starts with connecting with your female side and with your hormones and with your cycles and with not doing the pill and with everything that you have been talking about so many years. So I'm grateful for what you have spread.
Yeah, well, we're going to have to talk again, because you were, off camera, you were talking about like not going to the pill first and your thoughts about the way birth control pill is used. But I was like, this is the pregnancy episode, and we got to make sure that we like cover these topics for everybody who's listening, who's thinking about becoming pregnant, who's already pregnant, or who's getting ready to deliver. So I appreciate all of the information you shared. Just so much. I really appreciate it.
I'm glad to be here, and thank you so much.
I hope you enjoyed this episode. If this is the kind of content you're into, then I highly recommend checking out this.